This article is titled, Childhood Obesity and Adult Cardiovascular Disease Risk Factors, a systematic review with meta-analysis, and was authored by Umar, George Kelly, Leslie Cottrell, Peter Jacobi, Kim Innes, and others.
Despite the high prevalence of childhood and adolescent obesity as well as adult CVD, individual studies as well as previous systematic reviews examining the relationship between childhood obesity and adult CVD have yielded conflicting results. Studies were included if they met the following criteria: longitudinal and cohort studies, including case cohort, childhood exposure and adult outcomes collected on the same individual over time, childhood obesity, as defined by the original study authors, English language articles, studies published up to June 2015, one or more of the following CVD risk factors, outcomes not self-reported, and exposure measurements, child's adiposity, assessed by health professionals, trained investigators, or self-reported. Studies were retrieved by searching 3 electronic databases as well as citation tracking. Fisher's R-to-Z score was calculated for each study for each outcome. Of the 4,840 citations reviewed, a total of 23 studies were included in the systematic review and 21 in the meta-analysis. The findings suggested that childhood obesity is significantly and positively associated with adult SBP, DBP, and TG, and significantly and inversely associated with adult HDL. For those studies that adjusted for adult body mass index, BMI, associations were reversed, suggesting that adult BMI may be a potential mediator. 9 studies had more than 33% of items that placed them at an increased risk for bias.
We are article.tv. Links in the description below.